financial costs of prescription drug abuse, misuse, and diversion have grown significantly over the past 2 decades, along with the number of prescriptions for opioids and benzodiazepines. Health economists from Johns Hopkins University reported that the annual cost of chronic pain is as high as $635 billion, which is more than the yearly costs of cancer, heart disease, and diabetes. The Coalition Against Insurance Fraud estimates that opioid analgesic abuse results in up to $72 billion in medical costs each year. A 2005 Journal of Managed Care Pharmacy study found that patients who were opioid abusers had health care costs that were more than 8 times higher than those of non-abusers. The societal cost of prescription drug abuse, misuse, and diversion have also increased, with a steady rise in the number of prescription drug overdose deaths. A strong correlation exists between the number of deaths from opioid use and abuse and the number of retail opioid prescriptions from the past 2 decades. In addition to increased mortality rates, opioid abuse is creating a tremendous economic burden on the healthcare system as a result of escalating emergency room visits. In 2011, approximately 1.4 million ER visits involved the non-medical use of pharmaceuticals. In 1966, the use of gas chromatography, mass spectrometry, or GCMS, was first used to detect prohibited substances in athletes' urine. Since then, GCMS has been used widely to test athletes and became the industry standard during the 1980s and 1990s. During the early 2000s, liquid chromatography mass spectrometry, or LCMS, greatly improved in sensitivity, robustness, and reproducibility. LCMS has since become the industry standard. However, if drug testing technology does not evolve, false negatives will continue to increase, along with financial and societal costs. To address this problem, Precision conducted an analysis of 54,830 urine samples. Our goal was to answer a simple question. If sensitivity was not limited by technology, what should the cutoff levels be? For example, in our analysis of alprazolam, the current cutoff of 50 nanograms per milliliter causes many likely positive patient results to be reported as negative. These false negatives impact the doctor-patient relationship and cause doubts about regimen adherence. The trend line crosses the x-axis at approximately 5 nanograms per milliliter, indicating a more appropriate clinical drug test cutoff level. In another example, the distribution of amitriptyline, a common tricyclic antidepressant, also shows a truncated bell curve. The cutoff level should be 10 nanograms per milliliter instead of the industry standard 100. The missing bars on the left side represent false negative patient results. The need for lower cutoff levels is evident across drug classes: opiates, benzodiazepines, antidepressants, muscle relaxers, and many others. The conclusion of our analysis was that for 34 of 39 of the most commonly tested drugs, industry standard cutoff levels are inadequate to identify the likely positive samples in our patient population. This analysis was the impetus for launching the NextGen precision testing platform. The NextGen platform was developed to improve clinical data through statistically derived cutoff levels that optimize technological advances in LCMS, giving healthcare providers the best information to treat their patients, thereby improving outcomes by reducing drug abuse, misuse, and diversion. Let's look at the number of potential false negative results from NextGen precision testing versus current methodologies. Alprazolam is a good example of our findings. With standard immunoassay testing, false negatives will occur for a large percentage of samples. Standard LCMS technology is capable of detecting more than half of positive results. However, with lower cutoff levels made possible by highly sensitive LCMS-MS technology, NextGen precision testing is clearly superior, detecting nearly 100% of positive results. Available only from Precision Diagnostics, NextGen precision testing raises the standard for the drug testing industry.